Hello, 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 everyone. Welcome to our Diabetically Speaking with Smart Move 360 podcast. This is for those who just discovered us, and welcome back to ones who already following us for a while. This is the place where we meet with healthcare professionals, healthcare providers, people who are meeting with people with diabetes on a regular basis, and they are sharing their knowledge, expertise, experiences, and with the idea that it's supposed to help people who were recently diagnosed and don't know much about it yet. There is a lot of topics that you need to pay attention to, and we are trying to bring it to you so you will not be feeling lost. So many people are complaining that they went to the doctor's office, they got their blood work done, and they've got a phone call from the doctor's office a few days later. Your blood work show that you have elevated blood sugar, so you are diabetic. Prescription is in the pharmacy. We'll see you in 3 months, and then hang up the phone, and that's it. Not much instructions, information, and that's what we're trying to provide to fill in the gap between this phone call and then your next trip to the doctor's office. So when you show up there, you actually informed, aware, you have right questions, you understand what they're talking about, and you are all prepared. So today I have a great guest, Jacquie Will. We met with her a few weeks ago. She is working with this great company, MDWatch, and I would like to ask Jacquie to tell us about herself, and we will talk about the company during this podcast. Hello, Jacquie.
Hi, Arena. Thanks so much for having me on your podcast today. Excited to be here. Excited to share more about MDWatch and what we're doing. Just a little bit about myself. I've been with the company since 2021 when we started, a VP of operations for the company. Prior to that, my experience has been in healthcare and in finance, a little bit of mix of both. In the healthcare side, I've worked specifically with a company that created software for remote patient monitoring, chronic care management services. So my focus has always been on helping patients where they're at and providing services that are meaningful. And so excited to share, like I said, more about MDWatch and what we're doing specifically with diabetic patients.
Wow. I I just listened to this carefully, and so you actually were preparing yourself for the job that you are working right now, right? Because
Exactly. Yes. Yep.
you've got this information about the chronic diseases, you got the information about the software, the finances, all this, and now you are here in MD Watch, actually taking the best practices to work.
That's right. Yes.
Uh,
So the software we use today is actually from the company that I worked from previously. So it's really neat how full circle we'll be able to use the software to help manage these patients and go direct to consumer like we do with MDWatch.
Perfect, excellent. Well, now, of course, the question that is most important for today's podcast, what is MD Watch? I'm telling everybody, you need to know it. You know, you need to get it. You need to find out if you can qualify. What is MD Watch?
Sure, great question. Yes. So MDWatch is a remote diabetic monitoring program focused on helping seniors better manage their disease from home. And what comes with MDWatch in our program are prescribed continuous glucose monitors or the opportunity to connect an existing continuous glucose monitor to our program. Every patient is assigned a nurse practitioner who's meeting with them monthly to review the data that's collected from their continuous glucose monitor. And that nurse practitioner is also reviewing daily that data. So they're looking for any trends, changes, critical values, sustained highs, lows, so they can intervene early and help prevent adverse circumstances, with our goal always being to keep patients in their homes out of the hospital. Patients are educated through our program. I know a big thing is, understanding what affects glucose levels, the highs, the lows. So understanding how to keep patients in range to providing those educational materials. So everything we do is about monitoring and helping patients, like I said, better manage from home.
Okay. Well, okay, let's go deeper. This is the description, but how it works physically, how it works. So
Sure.
the CGM, people need to have CGM or you help them to get it? Do they need to pay for their CGM or you helping them to get it
Yeah,
with
absolutely.
some
So I'll
discount?
start from the beginning. First step in our process is we always want to find out exactly what's covered through a patient's insurance because we do bill our services. Continuous glucose monitors are billed through insurance as well. They're
Mm.
actually a Medicare Part B benefit in case anyone is interested in knowing where they're billed and how they're covered. And so we will verify a patient's insurance coverage first, find out exactly what's covered, any copay, coinsurance, deductible responsibilities. Once we've done that, we schedule patients with an initial consultation, typically with our MD on staff. And then during that visit, we want to understand where that patient is at on their diabetic journey. So health history, current medications they're taking, and at that point, then we go ahead and prescribe. If a patient doesn't have a continuous glucose monitor, we can prescribe either a Dexcom G7 or a Freestyle Libre 3. Those are the two CGM devices that are integrated with our software. Once the prescription is sent to our DME partner, that order is fulfilled. The continuous glucose monitor gets delivered right to the patient's home. Our team is following that delivery, and we will contact the patient to make sure they've received it. They get set up, it's connected. And what's great is that the continuous glucose monitors actually connect directly to a patient's phone. So they're able to get those alerts when they have the high and the low readings right on their phone to make immediate changes and take action. On an ongoing basis,
Mhm.
we then meet with patients on a monthly basis to do video visits so we can review that data from their CGM device, any changes in their health, any new medications, and then also provide those educational materials.
Perfect. So, just to clarify, this is additional, in addition to the doctors or doctors or registered nurses or PAs that patients are already have, right? They visit with them every 3 months or every 6 months, whatever time is their schedule is, but in between of those visits, they will also meet with your nurse, with your registered nurse to overview, to ask questions about those readings, because not everybody understands what those waves mean.
Yeah, that's correct. So we are by no means a replacement for a patient's primary care, a specialist, maybe an endocrinologist that they see. We work as an extension of those providers to meet with patients in between those in-person office visits. It's so important that patients still maintain having a primary care physician, having someone that they meet with in person. We want to work it as an extension, as mentioned, to those providers to help educate patients. And as Irina said, there are so many times where patients get alerts on their phone of these highs and lows, but what does that data actually mean? How can they make simple lifestyle changes to stay more in range? And so that's our goal, is to help educate patients and meet patients where they're at on their journey and from their home.
Perfect. Yes, this is correct. That we have so many panicking posts in our Facebook group when people have the CGM and their CGM is showing some extreme numbers, high or low, depends on the post, depends on the person, and very often they don't know what to do. And we have a lot of comments, a lot of recommendations from experienced users, but
Mhm.
everyone is different. And if they don't, if something helped to one person, it doesn't mean that it helps to another person. Plus, this regular recommendation have some orange juice if it is low. How much of orange juice? How do I know that it helped? So all these details, you can take care of it. Your nurses can take care of it, right?
Yes, and that's one of our big I guess selling points is that we tailor our care plans for patients. So it's not, one size fits all.
Mm-hmm.
We understand that everyone's at a different spot in their journey. Some may have just been recently diagnosed, some may have been diagnosed, 15, 20 years ago.
Yes.
And it's all about educating and providing the resources that patients need where they're at.
Mm-hmm.
And that may be nutrition, that may be exercise, managing stress, wound care, etc. That's all part of our program is providing the resources and the education that they need and want.
Okay. So, and if someone, you said it's once a month. So once a month is a kind of mandatory visit, planned visit with the telenurse. Well, not with telenurse, with the specific nurse that
Correct.
is handling your case.
Hmm.
But what if someone had something happen? I don't know, the surgery coming up. Maybe some other situation in life happened, and their numbers are totally, they don't understand what is going on. Can they have a call with this nurse in between those calls?
Absolutely. We understand that making it to every single appointment is not possible at sometimes, given circumstances, vacations, travel, hospitals, visits, etc. So, yes, we will. Our nurse practitioners are available for calls. Patients can always call our office and relay messages, and that nurse practitioner who's assigned to them would then return that call. We also have a patient app where within that application, patients can see their CGM data. They can log other vital measurements that they may want to track, like their blood pressure, their weight, mood, stress, pain, etc. They can track that within the app. And then they can also message securely with their health coach team, with their team of their assigned nurse practitioner. Those messages are read daily, and then the response time is within 24 hours of receiving that message.
Perfect. Okay, good, good, good to know. What I had a question, it flew away, of course. All right, then let's talk about this. Somebody you talking about right now, primarily these are Medicare people who already have Medicare. You said Plan B. What if
Correct.
someone doesn't have Medicare, but say maybe they're young or not there yet? Uh,
Right.
can you help those people? Can they be your, I don't know, in your care?
Yeah, great question. The services that we provide, remote patient monitoring, chronic care management services, those are a Medicare benefit. Those are service codes that are specific to Medicare. However, a lot of the plans follow suit of Medicare regulations and billing, and there are more and more plans that are covering these services. As a courtesy to patients, we always want to verify insurance first. We'll find out exactly what's covered. So even if you're not at Medicare age or don't have Medicare yet, please do reach out. We're always happy to check your benefits and find out exactly what's covered and see if we can provide services.
Okay, I remember now the question I had. Um,
Yeah.
the states. You
Yes.
are in many states in the United States, but not in all.
Correct.
How many states, where we could find the list of states that are
Sure.
covered, all this?
Yeah, absolutely. So today we cover 26 states. We're in all the large states, California, New York, Florida, Michigan, Ohio, Pennsylvania, to name a few. I won't go through the whole 26.
Texas?
Texas, yes. Yes, we are in Texas as well. a list of states. So when patients complete what we call our insurance verification form, so if you're interested in services, first step in our process is there's a form, an intake form that they fill out, name, date of birth, insurance information, and then there is a list of the states within that form that we currently service. And so if your state is listed there, that means yes, you're a go. That's a state that we can take and service today. That doesn't mean that we're not going to be expanding out to all 50 states in the future. That is always our goal, and we're working towards that each and every day.
Okay, so there is a hope. I really hope because
Yep.
I am in Georgia and I know it's a big state, but
Yep.
I know that you do not cover it yet. So let's find ways to bring it to every state,
Yeah.
so everyone who is watching us. And unfortunately, we have 30% of our Facebook group are out of state. They are from other countries.
Yeah.
So I hope that more organizations similar like yours will be popping up, maybe reaching out to me, and we could help them to spread this information further. All right. Okay. So, what about educational material on your website? It's only locked to those who you are serving, or people can Google MDWatch, find your website, go there, and educate themselves there.
Yes, great question. So, a majority of our education materials are shared with patients during their monthly visits, but we do provide some educational materials on our website. We actually just came out with a new diabetes guide where patients can download. It's a 22-page document. There's some really useful information about understanding diabetes, glucose, A1C levels. You can also get a shopping list on there of diabetic friendly foods, and it includes not only that, but recipes for breakfast, lunch, and dinner, and they are all diabetic friendly.
So this document is available to anyone. It's
Yes,
not
that document's
just
free. Yep, they can download it at any time, and they can download it from our website.
all right. So we will do this after the this podcast is on. We will in comments under the podcast, we'll put the link to your website or maybe to this guide since
Yeah, we can give you the link directly to the guide so folks can go straight there and download and access it.
perfect, perfect. We'll do that. All right. Okay. What about doctor endocrine? You said family doctor will be meeting with everyone who is signing up for the program. What about do you have endocrinologist working with your clients, with your patients?
We do. We have an endocrinologist who is our medical director. He is overseeing all of our clinicians. We have one MD who's like I said, a family doctor who's been in practice for 25 plus years. And then we have a team of 4 nurse practitioners. They're located throughout the US, licensed in multiple states,
Mhm.
and combined, this team has 60, 70 plus years experience. So,
Yes. Okay. All right. Just curious because a lot of times we have patients, I see those posts and in our
right.
support group meeting conversations, people either don't even know that endocrinologist is a doctor who specializes on that care for diabetic people. This is one thing. And the other thing is in so many places, a wait list to see endocrinologist is 4 months, is half a year, and these may be crucial months when people have to make really big changes to have a better chance to improve their condition.
Yep, absolutely. And our endocrinologist, he is available to our clinical team. He's reviewing patient data. He is providing oversight on all of our protocols, escalations as needed for patients, and available to our team.
All right, perfect. So they could always, if somehow your experienced nurses don't have an immediate answer, they could go and get the consult and come back with the uh, solution that people are looking
Absolutely.
for.
Yes. Yep.
Okay, perfect. All right, so what else we didn't cover? Do you have anything on your list that you wanted to share that I forgot about to ask about?
I think we got most of it, Irina.
Yes,
I think we
yes,
covered
I think this is close to the most of it. One thing I wanted to say that we spoke with Jackie and her team, and there is a webinar coming up. So tell
it.
us about this webinar.
Yes, Dr. Terry Ritterford, she is our MD on staff. As mentioned, she's been in practice for over 25 plus years as a family doctor. She's going to be speaking on Tuesday, November 12th. She's going to be speaking about diabetes care and management. So we're really excited for those of you who are interested to join that webinar and hear more from her.
Perfect. Yes. So we will be posting information how to get like registered or express interest about this webinar in the group as well. So to make sure that everybody who needs to learn from the doctor and ask the questions, I hope there will be a Q&A afterwards.
Yes,
They could do so.
we'll leave
Well,
time for sure.
perfect. Well, then let's do this. I need to make a couple announcements here, and we will go to that. So, announcements are, first of all, I wanted to remind everyone that um, we also have the Telenurse Tuesday program going on. These are our registered nurses, and one of the MDWatch registered nurses also expressed the interest to be a part of this nurses team. They answer your questions. So on Tuesdays, we have this post up in a group, and everybody is invited to ask your questions, your burning questions, what you at this moment are most concerned about, what you do not understand, what is puzzling you. Ask them. Our nurses are there to go over your questions at 7 p.m. Eastern Time. They open the Facebook group, they go there, and without showing their faces, they just sit there and type like crazy because there's a lot of questions sometimes, more than a lot. Okay, then on Wednesday, every other Wednesday, we have support group meetings. This is where we meet in Zoom, off the Facebook, so nobody will know that you were there unless you posted. And we are meeting there the fellow group members, admins, sometimes healthcare providers, dietitians, showing up there, and we discuss the challenges, the problems, sometimes discussing the blood work results, not exactly blood work results, but when you do not understand how this is working, our healthcare providers are always available to answer your question for these specific numbers, well, to the best of their abilities. Of course, on Thursdays, every Thursday at 4 p.m. Eastern Time, our podcast, Diabetically Speaking with Smart Move 360. Every Thursday, we have some healthcare professional provider talking with us about different parts. Like today, we were talking with Jackie about the this great service, MDWatch. But sometimes we may talk with the insurance broker. Sometimes we may talk with the doctor or the dietitian or a personal trainer. But the very last Thursday of the month, we are always inviting a diabetic warrior to join us. And so you could hear from people who live with diabetes, how do they do? What the struggles they have, maybe what is stressing them out, what steps they're taking, what their aha moments, what their suggestions to newly diagnosed. So these are our last Thursday of the month. And if you think that your story is unique and everybody need to learn about your experiences, reach out to me, please. We will put you in front of the camera, we'll give you the mic, and you will have a chance to tell your story. And of course, on Friday, Fitness Fridays, our Trevor Brown goes online at 9 a.m. Eastern Time and talks about different activities, movements, different exercises that you could start implementing right away. You don't need to be a club member. You don't need to have a special tool. You can start using the bench in a park, a step in your house, whatever is handy or not handy, but what is under your feet. So to help your body to get healthier. One last point I wanted to make that this coming Saturday, October 26th, we have our next 16th Diabetic Healthcare Expo. We start at 10 a.m. and we have 6 sessions with the lunch break where we have lunch and learn, and we have different healthcare providers talking about different aspects of life when someone has diabetes. And if you was diagnosed, if you know somebody who was diagnosed, if you taking care of somebody, or if you would like to avoid it completely, and you have this Saturday available, please join us there. You will have a chance also to type in your questions, and I will do my best to find the right person to answer your questions. If you will not have a chance to do so because you already have a plan, we will have it recorded and posted and featured posts, so you still will be able to go over and listen and ask the questions. Also, our providers will go over the questions afterwards. I will have an agenda posted, so you will also know which session to attend. With that, I would like to wrap up our meeting today with you, Jackie. Thank you so much for being available, for organizing this time for me and for our listeners. And I am really looking forward to continue working with you and helping more people to learn about MDWatch and provide them support in managing their diagnosis.
Thanks so much, Arena. We really appreciate the time. And yes, I encourage those who are interested in MDWatch and what we're doing to please check out our website, download that guide. It's free to you. And also, as Arena just mentioned, at the expo, one of our nurse practitioners will be speaking there as well, Christy. So hope you can attend and check us out.
Absolutely. Yes. More to come. Thank you very much. Have a great day, great rest of the week, and we will meet with you next Thursday.
Thank you.